Good morning. So I'm here today to talk to you about a partnership, a very, very big partnership called the Principles for Digital Development. The Principles for Digital Development arose out of a series of problems we were having. Programs all over the world, funded by all sorts of donors, implemented by all sorts of governments. We're using technology in a myriad of ways, but the systems that they were developing often lacked to have the sort of large-scale impact we were anticipating. We found that programs were siloed. They were unable to share information, sometimes even within the same sectors, or even in the same programs. You couldn't compare malaria data from one district in Nigeria to another district in Nigeria, because the way they collected that data was different. They're inflexible. You had a program where you were tracking the distribution of food, but you didn't have contracts that allowed you to redistribute it if it was in the wrong places. They were uncoordinated. So you would have 3 donors invested in the same program in the same country, or the government building the same system that a small NGO had set up 5 years earlier and was running at a large scale. And most of all, the number one problem we were having was something called pilot-itis. Everyone was innovating, innovate. They all needed to do something different, and it all had to be cutting edge. And what we found was all of that didn't add up to much. Lots of people spending lots of money on small programs that didn't add up. What do you do? So a whole group of us that had been playing in this space for close to a decade banged our heads together and said, we mapped it out, and we said, what have we learned? And we knew we didn't learn recipes, we didn't have to-dos, we didn't have a simple way of making these sorts of programs work. But we did notice that many of the projects we were working on had the same, that were successful, had the same underlying emergent design patterns. We found the same things arising again and again. And if you looked around to when people wrote those blog posts that were like, how to make technology work in Latin America, you would find the same core concepts arising again and again and again. And so we looked at all of those sorts of materials, these emergent principles of success that came up again and again and again, and we codified them. A group of donors and governments got together and collected 9 little bits of wisdom that we called the Principles for Digital Development. For anyone from the Silicon Valley, I have a software background, so anyone from Silicon Valley would look at this, you'd be like, well, this is obviously how you would do anything, otherwise you would fail. But in international development, unfortunately, many of these concepts are radical, crazy, and we really have to work with people to adopt them. But I'm going to tell a little story right now about how they all came together in October of 2014 in Liberia during the midst of the peak of the Ebola crisis. My team was working there, and we were tasked by the administrator, Raj, at the time, to understand how data could be better utilized. There was a lot of difficulties of understanding even something as simple as where the caseload was, how many people were sick, as well as what sorts of technologies could we quickly put into play to change the game. And so I twisted some arms, I called in some favors, and I got a lot of the people working on the ground to give me a rapid assessment in 1 week that we published for the entire community on what systems were actually set up and being used. Not what systems people said they were going to build or magical solutions they were writing blog posts about, what was actually going on the ground. Principle number 2, understanding the ecosystem. Then I implemented principle number 9, which was being collaborative. I gathered together a group of organizations as varied as small implementers on the ground, groups like IntraHealth that are large-scale INGOs, UN agencies like UNICEF, the Liberian Ministry of Health, and we collaborated around making something out of nothing. We had found 3 systems. One was a static database of all of the health workers in Liberia, 9,000 health workers. We had their phone numbers in that database. We had their names. We had what kind of health worker they were. We had a separate system that the Norwegians had funded. That system had all of the facilities, their locations, and where those facilities were. And then UNICEF had set up a text messaging platform. And that platform could send and receive text messages to numbers if you had them. So we connected all of these systems together using open standards. They were all open source, so principle number 6, to reuse and improve the existing systems, principle 7, through this process of collaboration. And what we got was, in the midst of the peak of the crisis, a way to communicate with 9,000 health workers on the ground, to ask them things like, do you have PPE? How many health workers are showing up at your clinic daily? So we could all of a sudden move from a situation where we didn't have much information to one that was data-driven. And we did it in a way of using existing systems that allowed for both scale and sustainability. And we did it with the ministry, right from the get-go, as well as the other partners and the health workers on the ground, sort of implementing principle 1, designing with the user. So is those sort of practice being used in real time as heuristics of thinking through how do we solve this problem that enabled us to sort of form something out of nothing and connect 9,000 health workers in the midst of the Ebola crisis? Thank you.